And there are certainly a lot of agencies involved. You've got people from the city, the county, and all around the region coming together on this. Plus, you have all these paramedics who have to show up places, sometimes not even knowing what they are up against.
This was a disaster drill that we observed back in 2012, and the bottom line tonight, first responders say drills like these are the reason they'll be ready if Ebola comes to East Texas.
It's a rare situation.
Tyler Fire Marshal Paul Finley spent his day making sure plans are up to date.
Our exposure control plan deals with lots of different items, both airborne and bloodborne type pathogens, and that is a living document that our employees are trained on.
Finley and others have been watching the situation in Dallas. He says we're better prepared for an outbreak now compared to just a few years ago, thanks to new medical technology and better cooperation.
We are in communication better now than we've probably ever been, but on a wider scale, we're in better communication with our partners around the state.
We go into people's homes and we catch them at quite possibly their worst moment, and we take care of them.
T.C. Howard handles education for ETMC's paramedics, so we asked him what kind of risk Ebola presents to them.
Yes, that is something we've been trained to do.
Howard says existing procedures are already designed to protect paramedics from bodily fluids, and that is the primary line of defense against Ebola.
EMS, this is Jessica. What's the address of the emergency?
But the 911 call itself is just as important. Now, more than ever, they're asking callers to answer honestly and completely when asked about a fever or travel history.
That's the question that we need to ask, both for our protection and the patient's protection and everyone else that comes in contact with that individual.
And you may have heard some of these Dallas paramedics are actually in quarantine now. They are hoping that with additional preparation they can cut down on any further need to do that. There are additional plans in place to protect paramedics. If the health department decides that we are at a high threat level, they will put those into place. They already exist. It's just a matter of putting the training into action.
Right, and Field, how is our communication locally? I mean, Paul Finley addressed it a moment ago. It sounds pretty good, but is it continuing as we watch the situation unfold in Dallas?
Well, it absolutely is. I can tell you that Paul Finley, after we shot that interview and after we shot the interview here, got together with the folks here. They had an additional meeting this afternoon, so things are constantly progressing and constantly changing as they learn more about what's going on out there. Live in Tyler Field Sutton, KYTX, CBS 19 News.
Thank you, Field. Of course, that location where Field is he's reporting from also holds the workers who dispatch the ambulances throughout East Texas.
And you know, they have their own special training for dealing with medical emergencies as well.
That's good to know. Now, we spoke to the CEO of Carter Blood Care today about the threat of Ebola in blood transfusions. Dr. Merlin Sayer saying there is no risk of that. People can still feel safe donating and receiving blood in East Texas. He says there haven't been any procedural changes in handling blood donations, and Carter Blood Care does have all the knowledge available about how to manage infectious diseases from world experts.
If anything, I'd like to be reassuring of the folks that are in Tyler and elsewhere, reassuring that this is not a disease that is going to be spread throughout our communities. It's not.
Dr. Sayer saying that any changes in blood donating procedures would be handed down to Carter by the FDA.
Well, the CDC is encouraging hospitals across the country to prepare for Ebola.
And of course, that includes hospitals here in Smith County. CBS 19's Risa Morris joins us live now with what healthcare professionals are doing to make sure East Texas is ready. Risa?
Mike and Jillian, doctors and hospitals across Smith County have been in continuous meetings for the past few days. They've also been receiving pages and pages of documents from the CDC, but they all told me they feel prepared to handle whatever may come their way. These hospitals have been preparing for weeks, and after a case of Ebola was diagnosed in Dallas, the preparations have only gotten more intense.
I think sometimes these events do kind of take a life of their own, and it gets a little scary, and we overreact in some ways. So we want to do things that make sense, that will keep our system going.
All of the hospitals are studying the Detect, Protect, Respond protocol. Doctors say this starts with the dispatchers.
It is the only question that really matters at this point. Where have you been? Where did you get this from?
After that question, doctors will then work to protect their staff and relay the necessary information to state and federal agencies.
There's a lot that one can do. It's not really until you're faced with the problem in your house that you really notice the deficiencies and the opportunities for improvement.
But to iron out whatever kinks they can before something happens, Trinity Mother Frances is going to hold a dress rehearsal. Doctors at TMF will work with a patient who says he or she is exhibiting Ebola-like symptoms and practice techniques. But they say healthy habits in the community are vital.
We have to remember that as a community, it is the most important piece is prevention. If you have a fever, don't go to school. Do not go to work.
Farrow and Moore both think this community is prepared if Ebola were to come here.
We are prepared as much as you can be now, and we're becoming more prepared each day as we learn more about it, and we respond by training, and that's kind of what we do.
Both hospitals do have the capabilities to isolate patients, which means keeping them in a contained room and making the air only flow in and out of that exact room.
So back to the ideas about what individual people can do to keep themselves safe and healthy. What kinds of things are they saying, Risa?
Doctors are recommending staying away from people that are sick and making sure you continuously wash your hands. Live in Tyler, I'm Risa Morris, KYTX, CBS 19 News. Back to you.
Use some common sense.
Just like Mom always said,
Yeah.
wash your hands.
Thank you, Risa. Now, if you are sick, doctors ask you to sneeze and cough into your elbow, and then just, again, stay home if you have a fever.
By the way, the hospitals will continue to have preparedness meetings over the coming days. Now, we have team coverage